that are coming in with respiratory issues, we are screening them at the front door, and if they have, if they show signs of possible exposure or COVID signs, we send them, if they're walkie-talkie, if they're able to come out to the tent, they will come out here. This is where we will treat those patients. If they are sicker than that and need to be in the main emergency department, we have an area in our emergency department with private rooms where we will place those patients, and they will be treated in those areas.
So the BlueMed system is an expandable system. Right now it's set up for 8 patients initially, but we can expand that up to 30 patients in this system. It's a self-contained mobile hospital is really what it is. And so it allows us greater flexibility in being able to take the patients that do screen positive for COVID and protect the other patients and not have them exposed to that.
So right now we are not testing outpatients for COVID. So if a patient is feeling symptoms consistent with the flu, which will be similar to symptoms of COVID-19, what we ask that they do is that they stay home. Of course, if they start to feel ill and need to be seen by a physician, at that point you'd come to the emergency department. This tent is set up for our low acuity patients with COVID-like symptoms, so the patients that are truly sick are still going to be seen in our main emergency department. I would also like to stress that right now this is part of a proactive strategy, so we have plenty of resources in our emergency department to treat the patients that are coming through. We've got plenty of masks, plenty of personal protective equipment. This is all just us being proactive and developing a process for if we do surge, if we do start seeing levels on par with Italy, do we have a process set up so we can handle that volume with protocols that are already in place.
This was a process. This is the first time that a system like this has been set up in our area. So a lot of trial and error and a lot of help from some of our partners with Horry County Fire, Myrtle Beach Fire, getting the process down and getting it finally ready to be